Okay, we're going to talk about that, trying to reverse the lockdown or back off of the lockdown in a responsible manner, which is what many municipalities are starting to look at now that we've been in it for a while. And some places are actually seeing great results. I happen to be blessed to live in an area where we hardly have any cases. I think in my county, we have a total of, is it 19 cases in all the hospitals in the county, with 0 new cases reported today. May not hold for tomorrow, but to have the growth of the infection spreading so limited, it does make us think, hey, we can figure out some way of getting ourselves back to a normal economy here. I don't know about places that are hit super hard right now, like New York is talking about how to get out. I don't know that that's something they can do right now, but we do need to be thinking and planning toward how we are going to make that happen. I'm sorry, I keep trying to remember what the other thing was we were going to talk about, but I will be able to, because I made an outline. That's why we're doing this new technique. So let me get caught up with your comments and questions before we get to that. Okay, somebody says better. Hi, doctors. Can still hear you. Broken, but we can still hear. Okay, that was before lots of thumbs up for once I fixed it. Thank you. Yes. Okay, sounds great now. Great. Okay, that that was more than I had hoped for. So I do pride myself on quality production, and sometimes it leads to a little distraction because I'm both the producer and the person on camera doing the talking. So forgive me for that. Let's jump into the slides here, and you guys go ahead and give me your questions and comments as I do that. So we have, and I'm still here in the corner. Up here, and then we can look down. I guess it'd be over this way to the words. That's just a little cover screen. See, I go all out for you guys. Next slide. Oh, that's what it was the article in Nature that just came out about viral shedding, and I wanted to let you know about that. So what we know is that people do start shedding virus or having virus come out of their body to infect other people 2 days, I believe the mean was like 2.7 days before the onset of symptoms. People are infectious before they have symptoms. So the so-called asymptomatic carrier state or asymptomatic pre-symptomatic state. You guys have probably already heard this, and that's why we're doing all the social distancing from just everybody, except for those in our own household, and wearing masks when we're anywhere, because we don't know who has it and who doesn't. 2 days. The other thing they said was it seemed to reach the peak about a day before the onset of symptoms. So not only are people shedding virus before they get symptoms, but they're actually doing it at the maximum. That's probably when most cases are getting shared or spread, when most spread is going on, is very early in the infection, when people don't even know they have it, or right after symptoms start and they haven't gone home from work yet, for example, or they stay for the full meeting. Thankfully, that's not a thing now, but that's how it was spreading before we knew to be careful with this. The actual figure was 0.7 days before the onset of symptoms that people were at their peak for shedding. Now, interestingly, this may not be, even though I just said what I did, this may not be the peak time that they're infectious, meaning that other people get the infection from them. I think I said that correctly. And this could be for a variety of reasons. One of them could be they're just not, even though they're making more virus, they're not getting it out into the air, like if they're not coughing. So if somebody's shedding more virus from their body but not coughing it out there, you can imagine how, okay, I can see how maybe somebody's more infectious with symptoms. That's actually not known. We just know that the maximum production of the virus from their bodies is just right at that onset or just before. And then the symptoms continue for 3 weeks. 3 weeks. This is the first time I've been able to see something that says how long the disease lasts. I've been looking. How long do people have symptoms? How long are they infectious? Well, this says for 3 weeks, and we do know they have symptoms up till the end. And in fact, they even still have a cough for about a week after they're not infectious anymore, making for about a 4-week duration total of symptoms. This will probably change maybe as soon as tomorrow with another study that's done that finds something different. But for now, Just so we have a ballpark, think in terms of 3 and 4. 3 weeks of being infectious and not being able to do anything, and another week of still getting over that cough, that lagging cough. Now, another question that's going to come up is about immunity and when people are actually able to be out and about and not be afraid of recatching or of spreading the infection. Let me get to that in a moment because it's part of the getting back to normal plan, 6-point plan I'm going to go over in a moment. First, I want to get caught up with your comments and questions through the chat. So let me back up. I see both Laura Spurs and Bianca are here. Why do I talk so much about Laura Spurs and Bianca? Because they're channel members. So if you go to the Auburn Medical Group page on YouTube and hit the join button, you too can get mentioned like they do and get the special little badges and is it emoticons or emojis, those little pictures of Gwen and myself that you guys can use. Okay, so I'm backing up. Oh, Deborah Wonker's here too. Very good. Somebody's heard that China had another outbreak. I guess that's one way of calling it. I'm in a city north of England. In the north of England, we have, this is Bianca, very few cases compared to bigger countries. That's like our county. We're in fact, our middle portion of our county is separated out for numerically from the more urban South Placer area and the very rural area around Lake Tahoe and just south of Truckee. And our area hardly has any cases. I think it was 11. Very, very small number. But then Sacramento and San Francisco, huge numbers. And then you go to a place like New York and really, really big numbers. So it's so variable still. All right, Laura. Oh, lots of visiting going on. Good. We're creating a sense of community. So that's a great thing. Self-quarantine for 2 weeks. Yeah, we're going to get to that. How long do we have to keep doing this? Oh, a message was held for review, but I'm not actually able to see it myself. And, oh, actually, I think that was Bianca's. Bianca, how do I allow your message? I don't know. I want to. Oh, show. There we go. Show. There's Bianca's message. Okay. All right, let's get to the next slide. Next slide. So the modification of stay-at-home orders, there are, usually this is happening, well, it happens everywhere. It happens at the state level. Here locally, we actually have different things happening at the county level. Many cities have done their own thing. So the modification of the stay-at-home orders is something that's being talked about. I know there's like 6 states in the East Coast, including New York and New Jersey. There's the West Coast states, Washington, Oregon, California, they're working together. This is a little set of criteria that was put out there by the state of California. The governor just spoke about it yesterday in a news conference that he had to talk about what is the thing that's guiding us. And he gave us 6 different guiding principles to use. And this is probably going to be very similar, although not identical, state to state. The East Coast 6 and the West Coast 3, maybe barely different, but they're going to have kind of the same principles to them. What is it we're looking for to decide when we can go back to normalcy? And one of the things that our governor pointed out is it's not a light switch that you turn on and off. It's more of a dial that you turn up and down how much of social distancing and stay at home and what businesses can be open, which ones can be closed. By having it graduated like that, we're going to be more easily avoiding just getting slammed with new infections and running our healthcare system. So gradual. So here's the 6 things. The first one, he said, was the ability to monitor and protect our communities through testing, contact tracing, isolating, and supporting those who are positive or exposed. I'm going to really zero in on one of those that's been of special interest to me, testing. We can hardly test it all. And the only test we have is the one for the actual active virus in the respiratory tract. So somebody has to be either almost symptomatic or symptomatic with it. It is not the antibody test that may or may not tell us if a person's immune and had the infection. More on that later. So we have to limit our testing because of the limited tests. This is a problem and it is being addressed. There is a lot of effort going to producing more testing kits and getting them in the hands of doctors like myself and to public health officials like our county health officials here in our county. One of the tests that I'm especially interested in is the serology or antibody test, which may tell you if somebody has immunity to the virus. That's what we're hoping it actually means. We don't know. There just is not enough data to make a decision on something like that yet. Something else I want to say about the serology test is there are some that are being sold to doctors' offices right now that are not FDA approved. And I've heard some people talk about using them and finding that they have no faith in the results at all. Well, the FDA actually has this emergency use approval for things. I think it's emergency use EUA. And they are putting it out there for lots of tests. But so far, this one for serology that people have been getting in their doctor's offices, they haven't approved it because there's just no data at all. Or I shouldn't say at all, but just not data that gives them a sense that this is going to be useful information, the results from this test. But yesterday, April 14th, the FDA did do an emergency use approval for 2 antibody tests. So they are out there, they are approved. It's just a matter of manufacturing enough of them, getting in the hands of doctors like myself and county health officials and hospitals. So it's coming. It shouldn't have been this long, but we're stuck with what we have. And this is going to be one of these steps. Here, I need to point the right way. One of these steps here toward getting information about who can go back out and go back to work and start being out in the public. That's one of the things we're looking for. Okay, what else? Number 2, the ability to prevent infection in people who are at risk for more severe COVID-19. Prevent infection for them? Well, a vaccine would be great, but that could be a year off. Although we will have data next month about human trials, which is amazing that it's happening that fast. Things are really on the fast track for this. And there are a number of companies working on different approaches to a vaccine all at the same time. So I'm hopeful for that. The next one, the ability of the hospital and health systems to handle surges. Some places have that, some places don't right now. And that is one of the factors that they're going to be looking at. The ability to develop therapeutics to meet the demand. Therapeutics? We really don't have any solid therapeutics. They looked into chloroquine or more hydroxychloroquine and hydroxychloroquine with azithromycin, and there's some other things. It looks like the antiviral drug that was used for the Ebola virus, Remdesivir or Remdesivir, excuse me. Even I have trouble with doctor speak sometimes. Remdesivir does seem to be promising, and there's lots of trials with it right now to see if it actually does. And it does look like it's helpful. More helpful than hydroxychloroquine, which has been disappointing. The next one, the ability for businesses, schools, and child care facilities to support physical distancing. Schools, physical distancing, I think we already have crowded classrooms because of limited budget to make it otherwise, so I don't know how they're going to do that. I think about my own business. What's this mean to me? Well, okay, our waiting room is the place where we're going to have to make a difference. We've already made a difference with our workspaces, except for myself and Dr. Gwain. We're still within 6 feet of each other, but everybody else, we've spread out, which helps when only half the crew, or a little bit more than half, is actually at the office at any given day. So desks usually have 2 people working side by side. There's just one person there. And some people are actually not at work during this period, using the unemployment benefits that we have to be able to still get them paid, although not at the full amount. But at least they're able to have that time to be with their family or do something and still get 2/3 of their income. The waiting room. We don't really have a full waiting room normally anyway, because that's just our priority to get patients into rooms. And with rooming patients straight from outside of the building, we actually have patients call in to the office from their car to tell us they're ready to be roomed. And then the MA goes out and gets them when it's their turn and takes them into the room. So we don't have people sitting next to each other in the waiting room. That's how we can do it. Schools, classrooms, I don't know. I'm glad I don't have to fix that. The last one, the ability to determine when to reinstitute certain measures, such as the stay-at-home orders, if necessary. That's part of this dial it up, pull it down sort of approach that we're going to have. Is we're going to have to put some things back in place after we pull back if we see that the numbers are increasing at the hospital, for example. Let me get to your comments and questions. So looking back down here, somebody's having a fever once in a while. Is that something they should worry about? Yeah, it's something to be, talk to your doctor about that. I'm trying really hard not to practice telemedicine over YouTube. The state board would probably look down on that. We also have somebody waiting for test results. Thankfully, the tests are getting quicker, at least in our area, at coming back. High temperature may be a symptom. Oh, yeah, you're talking to the other person there. My respiratory doctor is in Truckee, and they called and said, all cancel appointments until further notice. Yeah, hopefully with these things we're looking at here, we're going to start having regular doctor office visits, maybe be one of the things that comes back before, I don't know. I don't mean to pick on anybody's business and say it's not as essential, but I'd really like to see a pulmonologist start seeing their patients soon. And maybe that will be one of those things that comes. Oh my goodness, we have a new, okay. I'm going to go ahead and do something and just take over the show here because we have a new channel member. We're going to celebrate our new channel member, the Pompeii Ranch. Welcome, Pompeii Ranch. We are glad to have you be a member of the Auburn Medical Group. And so we are going to fully celebrate you. And depending on what level of member you are, you might even get your name mentioned in videos in the future or in the description of videos. All right. Let's see what else we have here. Bianca's daughter said my life ruined because someone scrammed a bat. LL, she's 16, over dramatic. Oh, okay. And of course, greeting Pompeii Ranch. Almost done teaching at the Army base for 2 years. Worried they won't be able to get back to the U.S. in June. So people in the military coming back. Don't know the answer to that, and of course our hearts go out to you and your family with this unknown. But thankfully they're safe, so that's a good thing. People in the military, was it the is it the Teddy Roosevelt? Is that the name of that carrier that got knocked out of ability to function because of COVID spreading the infection inside of the? It was an aircraft carrier. Believe it's the first time an aircraft carrier has been knocked out of commission or out of function since World War II. And it was done by a virus. We spend I'm getting political here. Oh, I can hear Gwen saying it now. We spend all this money on defense and it's a total waste right now on that carrier. I don't know how much money a carrier costs, but maybe that money was spent toward better preparation for public health, and we knew that there was a threat of pandemic. We've been having these influenza pandemics, and we know that it's a possibility, and keep spending money on, I'm sorry, I need to not get political. All right, especially if one of my brothers listening. Ooh, I can imagine. All right, getting back to our slides here. Okay, we went through all the slides, and we went through all the comments. And if you have any final questions or comments, I'll be glad to address those. We are so glad to have a new channel member with this show, Pompeii Ranch. And we'll be looking at your channel and learning more about that. Look forward to that. And we will continue to bring you information and updates intermittently. I'm sorry that we haven't been as regular with the effects of COVID-19 on our practice, so we haven't been doing all those regular 4:30 Monday afternoon live presentations. Let me know what you think of this format here in the evening, and with just a little bit of text, some graph to go along with it. I don't even have to be doing that anymore. I can do this now. I don't know. Maybe you don't want to see my face real big and giant, but I feel like it's easier to listen to someone that way than having the text information take up most of the screen. So thank you again, everybody. And until next time, this is Dr. Mark Vaughn telling you to stay in good health.